Kylie Jenner finally reveals a plastic surgery that she actually had done. Beckinsale says that a rare medical condition is the reason she hasn't had any procedures. In Afghanistan, the Taliban has banned all beauty salons. This and more in our weekly aesthetic news recap. Yes, Kylie Jenner did get plastic surgery. Kylie Jenner has now admitted roughly 6 years after the fact that she had gotten a breast augmentation just before she got pregnant with her daughter at age 19. Just a few Kardashian episodes earlier, Kylie Jenner insisted that she'd never gotten any cosmetic surgery at all. She expressed remorse over this surgery, and I just wish, obviously, I never got them done to begin with. I would recommend anyone who's thinking about it to wait until after children, she continued. In the past, Kylie insisted that it was a Victoria's Secret push-up bra that was doing the trick. One question I have is, how much more is she hiding? Will there be more truths that come out in the future? It also raises an interesting discussion of whether or not people should be getting surgery at such a young age, especially cosmetic surgery. But should an 18-year-old or a 19-year-old agree to a cosmetic procedure, or should they wait until maybe their thoughts mature some more before making a very important decision to have plastic surgery, which is permanent? I mean, some elements might be reversible, but in many ways it's not reversible. So some people do end up regretting procedures that they had in these younger years. People are turning to lip lifts and corner lip lifts to reverse a resting face. One patient mentioned in the article, "The corners of my lips were always facing down. Now I have this perfect pout." According to a member survey from the American Academy of Facial Plastic and Reconstructive Surgery, which is the organization that I'm board certified with, lip lifts were up 3% in 2022. As most of you know, this happens to be a surgery that I do often. We actually tell patients in recovery to practice a resting face because you want to limit the activity of the upper lip for 2 weeks after surgery for optimal healing. The challenge of lip lift surgery, beyond creating a presentable scar, is of course to figure out how much skin to remove. And this, of course, is part of the art of plastic surgery. A new study finds that 2 in 3 cosmetic surgery injections in the UK are not administered by doctors. Researchers from the University College of London evaluated 3,000 websites to pinpoint 1,224 independent clinics and 3,667 practitioners administering cosmetic injections. They found that 32% were doctors, 13% were nurses, 24% were dentists, and 8% were dental nurses. The authors point out it is essential for the practitioner to be competent in performing the procedure and to be able to recognize and treat potential complications. The UK government is preparing to update its policy around these treatments. My thoughts are that it's not enough to just be a doctor to perform injections on the face, especially. You need to have proper training in these procedures. You need to have not just training as in you're sitting in a lecture hall and writing down notes on what the professor or the lecturer is saying, but you need to actually get hands-on experience with these types of injectables before offering them independently. Then you need to figure out how are you going to deal with the potential complications that come up with doing injectables, such as vascular occlusion, such as injecting too much and having to actually reverse it. Infections, for example. These are different problems that come up, and I don't think it's enough to just be a doctor who does injectables. So in this article, they point out that, hey, maybe it'd be great if more doctors were doing these injectables instead of nurses. But I would argue that there are some nurses that are well equipped and sometimes better equipped than certain doctors to do these types of aesthetic injections. And that's something that we need to truly consider. Please like the video and subscribe to the channel with notifications on. Thanks. Meanwhile, Beckinsale, who's now 50 years old, insists that she hasn't had any plastic surgery or injectables after speculation of a recent red carpet appearance. She has denied all cosmetic procedures, including Botox and fillers. And the main reason she gives is her condition called mast cell activation syndrome, which can lead to episodes of severe allergic reactions. Numerous triggers of mast cell degranulation have been identified, including food products, medications, extreme temperature, pain, psychosocial stress, mechanical pressure, and hormonal fluctuations. The perioperative setting presents a unique challenge for these patients as it exposes them to many of these risk factors. While Kate's condition may be the reason why she hasn't had any cosmetic procedures, there are ways to mitigate the risk for patients with MCAS, and many do undergo uneventful surgeries with the proper precautions, especially trying to avoid general anesthesia if at all possible. Brits who are risking cosmetic surgery abroad are taxing their healthcare system. A growing number of people are returning to the UK with complications ranging from wound healing problems to life-threatening sepsis. The number of people needing hospital treatment in the UK after getting cosmetic surgery abroad has shot up by 94% in the past 3 years, with procedures carried out in Turkey accounting for more than 3/4 of those in the past 6 months alone. Last year, the procedures were estimated to have cost the health system around £1.7 million, prompting calls from health bodies for the government to act. Turkey has become a hub for cheaper cosmetic surgery. There are, of course, reputable doctors who do outstanding work in the area of, say, hair transplants or cosmetic dental veneers. But with such an active market, plenty of unsafe, poorly supervised, unlicensed clinics have also cropped up. I think Turkey needs to increase its safety regulations, and people need to do their homework and do thorough research to figure out which doctors and which clinics are truly reputable and the right places for them to travel to for their surgeries. People need to remember that cosmetic surgery has real risk that can at times be life-threatening if not managed properly. The Taliban has ordered beauty salons in Afghanistan to close despite UN concern and rare public protest. The Taliban said that it decided to ban beauty salons because they offer services forbidden by Islam and cause economic hardship for the families of grooms during wedding festivities. The Taliban listed a series of services offered by beauty salons that it said were in violation. They included eyebrow shaping, the use of other people's hair to augment a woman's natural hair, and the application of makeup. Their closure will lead to the loss of an estimated 60,000 jobs, mostly for women. The United Nations said it was engaged with Afghanistan authorities to get the prohibition reversed. I believe in the freedom of expression and in women's complete rights. It was with my mom's determination that we even made it into the United States, and my wife is a physician, and my daughter is already proving to be a force to be reckoned with. I hope that the women of Afghanistan eventually get the rights that they deserve. In case you missed it, check out last week's Aesthetic News Recap.